All right, welcome to this explainer. Today, we're diving into a really fascinating and honestly highly practical framework from Everblink Health Care called Bridging Uncertainty. We're going to take one of the biggest sources of medical anxiety, the unknown, and actually flip it into a massive opportunity to build patient trust. Because look, if you work in healthcare, you already know that making the clinical diagnosis, that's really only half the battle, right? Communicating it effectively, well, that's the whole other half. So let's just dive right in.
What if the absolute hardest part of healthcare isn't making the right clinical decision, but rather explaining that uncertainty in a way your patients can truly grasp? Just let that sink in for a second. Medicine is fundamentally built on evidence, sure, but we all know that out in the real world, not every clinical situation comes wrapped up in absolute certainty. There's this massive, undeniable tension between evidence-based medicine and unpredictable clinical realities. And it's right there, right in that messy gap, where your communication skills literally become just as critical as your clinical knowledge.
To help navigate all this, we've got a clear roadmap for today's explainer. We're going to start with 1, the challenge of uncertainty. Then move to 2, risk versus uncertainty. Next up is 3, preparing for the conversation. Then 4, clear and honest communication, followed by 5, listening and managing emotions, and finally 6, shared decisions build trust.
All right, let's start with section 1, the challenge of uncertainty and how we balance honesty with empathy.
So the core problem here is that even with the most careful planning, sometimes test results are just inconclusive. Outcomes vary. As healthcare professionals, we're constantly walking this really tight rope between being completely honest and being empathetic. Just think about the high-stakes scenarios we face all the time, explaining possible treatment risks, discussing uncertain diagnoses, talking about disease progression, addressing totally unexpected complications, or even talking about prognosis and future care. In these incredibly vulnerable moments, patients aren't just looking for cold, hard medical facts. They're desperately looking for reassurance, for guidance, and the way you deliver this information, it's going to significantly influence their emotional well-being.
Moving right along to section 2, risk versus uncertainty, defining the playing field.
We really need to define this playing field, mainly because in medicine, these two terms, risk and uncertainty, are tossed around interchangeably all the time, but they are not the same thing. On one hand, you have risk. This is a situation where the likelihood of an outcome is pretty reasonably understood based on clinical evidence and hard statistics. Think of a known percentage of side effects. But on the other hand, you have uncertainty. This is where evidence is limited and outcomes simply cannot be accurately predicted, like dealing with rare conditions or rapidly evolving diseases. Recognizing this exact distinction is absolutely crucial. It keeps you from accidentally setting up unrealistic expectations for your patients.
Okay, section 3, preparing for the conversation. This is our pre-discussion checklist.
It's time to shift gears from theory to actual practice. Look, relying on a structured framework is what protects you from getting completely derailed when emotions run high. So, here is a really practical 4-step checklist to run through before you even step foot in the patient's room. Step 1, review all the available clinical information. Step 2, anticipate the common questions they're going to ask. Step 3, explicitly identify exactly where the uncertainty exists. And Step 4, plan out how you're going to explain this incredibly complex information using simple language. Taking just a moment to do this drastically reduces confusion and really boosts your own confidence before the conversation even starts.
Now, what's really fascinating is what happens the very second you actually start the conversation. Before you launch into all the medical details, you absolutely have to assess the patient's baseline knowledge. You can ask simple things like, can you tell me what you've understood so far? Or what concerns you the most right now? This is always step 1 once you're in the room, because it instantly highlights any misconceptions they might be holding on to, which then allows you to tailor your entire explanation directly to their specific level of understanding. It's a total game changer.
Which brings us to section 4, clear and honest communication, navigating statistics and the unknown.
So this is the execution phase of our toolkit. When you're dealing with risk, raw statistics can be incredibly overwhelming for stressed-out patients to interpret. You've got to use plain language and absolutely avoid making unsupported guarantees, like telling someone a treatment is completely safe. Now, I know this brings up a very common clinical fear, admitting you just don't have all the answers. A lot of folks worry this makes them look, well, incompetent. But here's a really surprising fact for you. Behavioral studies actually show that thoughtful transparency strengthens patient trust. Admitting uncertainty isn't a weakness at all. It actually demonstrates profound professionalism.
To help make this easier, our source provides some fantastic, ready-to-use phrases that you can literally put in your pocket for your next shift. Take this exact quote. Based on what we know today, this is our best recommendation. It is such a high-value script. It honestly acknowledges that our medical knowledge might evolve. It owns the unknown, while firmly keeping the patient's care and your clinical guidance as the absolute priority.
Here's a second incredibly practical phrase you can use. There are still some uncertainties, and we'll continue monitoring closely. As more information becomes available, we can adjust the treatment plan. This is brilliant because it so deeply reassures the patient. It essentially tells them that, hey, even amidst all this uncertainty, you are not being abandoned to the unknown. Your condition is being actively managed, we are supervising this closely, and we're going to adapt the plan as we need to.
Let's transition over to Section 5, Listening and Managing Emotions, or the silence between the words.
Now, I am intentionally slowing down my pace a bit here because communication, it's not just about what you're saying. Listening is equally, if not more, important. Notice the key elements in this active listening checklist. We're talking about allowing pauses, literally just giving the patient a moment to breathe, encouraging questions, acknowledging their emotions without any judgment whatsoever, and confirming their understanding before you move forward. Giving patients that quiet space to process helps them feel truly heard. And you know what? When they feel heard, they are far more likely to participate actively in their own care.
Look, when you're discussing uncertain outcomes, natural emotional reactions are absolutely going to happen. It's human nature. Your job is to remain calm, validate those emotions without making any assumptions, and whatever you do, don't rush your explanations. Sometimes all you need is a simple, compassionate statement like, "I understand this is a lot to take in." It's so simple, but it fully validates their reaction, creates a really supportive environment, and keeps the whole conversation deeply respectful.
Which brings us to the resolution of our framework in Section 6, Shared Decisions Build Trust, Partnering in Care.
The ultimate goal when you're facing these uncertain medical situations isn't to magically have every single answer. That's impossible. The goal is making clinical choices together. This kind of shared decision-making means you present the available options objectively and you discuss the potential benefits right alongside the limitations. You really take the time to understand the patient's personal values and preferences, and then you reach a decision together whenever possible. Patients who understand the clinical evidence and, honestly, the uncertainties surrounding it ultimately feel so much more confident in the care they're receiving. I really want to emphasize this one core message today. Communication is a clinical skill. Clinical expertise alone does not guarantee effective patient care. Just like placing an IV or interpreting a really complex ECG, empathetic communication is a learned, practiced medical skill. It gets better with practice, with reflection, and with continuous learning. When you can comfortably acknowledge uncertainty while still providing clear guidance, you're actively fostering trust and significantly improving patient satisfaction. It's that simple.
So, I'm going to leave you with this final thought and a question. Are you ready to transform clinical uncertainty into patient trust? Difficult conversations are rarely ever easy, but they are absolutely among the most meaningful interactions you will ever have in healthcare. By combining structured communication frameworks with genuine empathy and transparency, you can take a really challenging discussion and turn it into a masterclass in patient-centered care. Next time you walk onto your shift and come face-to-face with the unknown, I hope you remember these tools. Thanks so much for joining me for this explainer, and keep learning.